Hello, a very good evening, everyone, and welcome to another webinar in our autoimmunity series. I'm Dr. Ruhi Agarwala, co-founder of Functional Medicine Clinic, and I'm excited to welcome all of you today. So today we are going to talk about lupus, also known as systemic lupus erythematosus, and yeah, as usual with any autoimmune condition diagnosis, um, there's always this thing that is told to that individual that, okay, this is for life now. You have to live with this autoimmune condition. And it's like, the entire world just shatters in front of you. But is that the reality with any autoimmune condition? Something that you've acquired in your life, can you not do anything about it? Can you still not have a good quality of life? So today we will be talking about lupus, very commonly seen in women, and we see it again in the younger age group, also in their early 20s, 30s. So what can we do about it? And what is that we are doing differently in functional medicine compared to what is generally done in conventional medicine? So with that, let's get started. And I have with me Dr. Shefali Jaiswal. She's a functional medicine practitioner. She has been a part of the functional medicine clinic for the last more than 2 years now. And welcome, Dr. Shefali.
Thank you, Dr. Ruhi.
The floor is all yours.
Thank you. So I'll just share my screen.
So in case you want to tell about, your journey into functional medicine, please go ahead before you jump into this topic.
Yeah. So good evening, everybody. So as Dr. Ruhi mentioned, I've been working for almost 2 years now, and so far journey has been amazing. And so I come with public health background, and we have been studying about prevention of choices are not always an option. I mean, sometimes with very, very severe cases, maybe you have to, but most of the time, if you change certain things in your life, then of course, your, as Dr. Rui mentioned, quality of life and your overall journey will be amazing. So I hope this session is quite insightful and maybe it can change perspective of your thinking that, medicines are not and always the option. So let's start the session and let's know what is lupus and how can people who have it, they can recover. So So we'll be going through the following contents. We will know what is lupus. We will discuss its pathophysiology, what are the conventional line of treatment methods, and what are our approaches, and we'll also discuss a case. So first, lupus is nothing but a systemic autoimmune disease which involves different systems of the body. Now, it can be mild. It can also be sometimes multi-organ. It also can cause severe nervous system involvement as well. Now, there are a lot of factors which are involved. It could be genetic, it could be immunological, sometimes endocrinal, and also environmental factors which it can cause. And based on these things also, they are classified under 4 different types. So the systemic lupus is when it can be mild or severe, when it can affect all parts of the body. Cutaneous is nothing but when it is only infecting the skin or any kind of rashes or lesions are seen on the skin. The drug induced is mostly because of the drugs like hydrolysines or procanamide or isoniazid. All these medicines can induce. The neonatal lupus is when a woman who is infected with lupus and she is pregnant, and when the child gets it, then it's called neonatal lupus. Now, often we have come to know that these are the most common risk factors, where first is, the women are most commonly affected because, of course, they have estrogen and prolactin hormone, which can trigger autoimmunity. And because of this, your B cells activation or lymphocyte or dendritic cell activation can take place. I'll discuss this in the next slide also. But not only women, sometimes men are also affected. And in men, the disease severity is even more. So maybe they have a lot of, severe skin infections, they have neurological conditions, cardiovascular issues also. Now, drugs, we have, or any kind of sulfur drugs can cause infection or can cause this. The ultraviolet rays, sun exposure, viral infections, uh, and smoking, and exposure to silica, or even sometimes vitamin D deficiency, alfalfa sprouts or soybean sprouts. These are most commonly known risk factors. But in recent years, with a lot of functional medicine practitioners, a lot of research happening, we have also come to know that these are also contributing risk factors, like people who take gluten or dairy products, somebody who has chronic stress or trauma, exposure to heavy metals, mycotoxins, or any kind of fungal exposure, having digestive disorders, poor gastric secretion, SIBO, IBS, again fungal infections, autoimmune, celiac diseases, or any kind of dysbiosis, or specifically lack of bacteroides uniformis. And also, if you have any of these dysbiotic bacteria, they also can trigger this autoimmune condition. Now, if you see lupus, we call it systemic condition. So, it can affect any of the parts. So most commonly it is arthritis, which people can see. Then Raynaud's disease is one more. You can see acute lupus, cutaneous lupus as well. You can also see mylar rashes, and also you can see that there are certain neurological diseases also. Now, in children also, neurological diseases or renal diseases are quite common if the child is infected with lupus. So what happens that people get lupus? So we all know that we have innate and adaptive immune responses. So in innate immune responses, suppose if you get any kind of bacterial infection or any kind of superficial infection, our innate immune response gets activated. So these are the three main cells which work on this. That is the plasmacytoid dendritic cells, the neutrophils, and the macrophages. Now, in case you have any kind of autoimmune condition, now what happens here is the cells, they change their something called as like macrophages. They lose their polarization, and then the all the cells have to die, which is called as apoptosis. But what happens is, because there is some kind of autoimmune condition, this apoptosis doesn't happen properly, and there is a distribution of nuclear material which actually the body has to remove. But because of this autoimmune thing, these cells are still present in the system. And similar thing happens with neutrophils, the plasma dendritic cells. Also, they increase the interferons, and reactive oxygen species also start increases. Because of this nuclear material, which had to be removed and still it is there in the body, what happens is the T cells and the B cells, they start behaving abnormally, or they start behaving like in fighting against what we say as autoimmunity. They start fighting against its own cells. And because of this, the main and the classic example of how you can detect lupus is ANA, that is the anti-nuclear antibodies. They start appearing. And with that, there is something called as anti-double stranded DNA antibodies, which also can be seen in lupus, and it is a classical feature of lupus, which is also, and most of the time it is detected with this only. So these are also seen. Apart from that, in adaptive immune response, so adaptive immune response is something like, once your body has got infected with something, then your body has a memory of it. For example, measles, okay? And now next time when you get it, your body will fight against it, and you will not have any kind of symptoms, or you will not show any responses. So our B cells, the T helper cells, they are responsible for adaptive immunity. But with autoimmune condition, this whole cycle is disturbed. So with this, there is something else also happening, which is called as mitochondrial dysfunction. Now, as we all know, mitochondria is present in the cell and it is the powerhouse of the cell. And it's absolutely important that mitochondrial function should be good for any good bodily functions. But with this B cell disturbance and that double stranded DNA follow happening, I mean, because this double stranded DNA is formed, what happens is the ATP production reduces, the amino acid metabolism is also impaired, the LDL starts increasing, and hence you can see that a lot of mitochondrial dysfunction starts happening. So with that happening, there is very, very common thing which is also present in lupus cases, which is called as sun sensitivity. So we all know sun is very important for our circadian rhythm. We move according to sun. But in lupus cases, people are very sensitive because what happens is the moment they go step out in the sun, their cells are damaged, and anybody who's stepping out of cell into the sun, some kind of cell damage is there, and but your body starts repairing it within no time. But in case of lupus, this damage is not cleared, and your dead cells are in the body for a very, very long time, and that again increases the autoimmune attack. So again, one question is sun really bad for people who has lupus? I mean, that question I think we will have the answer towards the end of the session. Now, when we see the conventional method of treatment, we mostly see that doctors are trying to reduce the flare-ups. They are trying to reduce any kind of organ damage. They're also trying to minimize the toxicity. So there are three main things which are done. So maybe they will go with a non-drug approach where they give you sunscreen. If you at all, you have to step out of the house, stop tobacco, smoking, or your pain management with hydrochloroquinones or corticosteroids, or giving you immunosuppressant like methotrexate. But I don't think that is the only thing which is needed. And when we are dealing with this kind of condition, it is also important that you should know how the patient is experiencing, or what are the positive aspects which you're noticing in the patient. So it's also important to evaluate their signs and symptoms in a much numerical way also. So these are few indexes which have been mentioned, like SLE disease index, British Isles lupus assessment group index, then physician global assessment, SLE responders index. So these indexes will give you how, if at all you're doing the treatment, how is the disease activity in 30 days? How is the disease activity in past 2 weeks? So that's how we will come to know with these tools. Because when you're treating somebody, you also should know that what is working for him or her and what is not. Apart from this, there are a few tests which can be done, like the food intolerance or allergy or sensitivity test, the gut dysbiosis test, heavy metals can be checked, fungal infections or any kind of mold exposure or mycotoxin exposure can be also checked. Methylation dysfunction can be checked, and also a detailed blood test which can show us with inflammatory markers can also be done. Now, let's go deeper into the case and let's see that what are the changes or how can these issues can be solved. Now, so we had a case of 27-year-old female with lupus. So these were her symptoms when she came to us. It was that she had hypothyroid. She also had lupus nephritis. Gut issues were also there, bloating, uh, stomach burning. She was not able to eat any of the pulses, any wood thing or any kind of masalas. Everything would cause stomach burning. Sun sensitivity was there. Sinus headache, sensitivity to cold and hot, muscle cramping, body pains, difficulty in sleeping, poor appetite. This itchy fingertips in winters were also there. When she came to us, she was already taking for her thyroid, thyroxine. She was also taking phenolic acid tablets. She was also taking HCQs for her weight. She was also taking PAN-40 for her gastric issues. Now, if you see her blood test, you can see here that she had really high inflammation. As I told you, ANA is a predominant anti-inflammatory marker which is present in lupus cases, and you can see here that it is around 146. And lipoprotein is around 41. Homocysteine is also quite high. ATG is also present. Infections, you can see that her WBCs, monocytes, basophils were low. She was deficient on magnesium. She also had a lot of B complex insufficiencies. Her proteins were low because because she had this dysbiosis, the body was not able to absorb any kind of nourishment. She also had a lot of heavy metals. You can see that lead was around 56. In her organic acid testing, as I told you, mitochondrial dysfunction plays an important role, and you can see that mitochondrial dysfunction is present. Dysbiosis, fungal infection, clostridial overgrowth were also present. So with these things, we can know that, there is something which the body is not able to do. And for that reason, you have to remove certain things which are triggering these things. So if we see in functional medicine approach, these are the factors on which we work. And so a first thing was a comprehensive assessment was taken where a detailed history was taken, and any kind of like I mentioned, pulses were triggering her condition. So any other things which was triggering her condition, we had taken a note of it. We were also trying to find out what is the root cause, which is the first and foremost and the basic thing which we do in functional medicine. We also tried to optimize her gut. So, we addressed her dysbiosis, her leaky gut, any kind of food intolerances, so that the inflammation and that immune dysregulation could be sorted. Now, diet and nutrition. So, removing any kind of food that was causing issues, and also introducing foods that were good for her immune system was again done, and removing the environmental toxins. So like I mentioned, her lead was quite high. So anything, if she was exposed to any kind of chemicals or anything, we took a note of it. So with that, we also tried to improve her detoxification pathway, so that the body was able to remove these toxins easily. Now we also address the infections. We also improved her mitochondrial health, exercise and mobility, because with inflammation and with lot of pain, body aches, with muscle cramping, mobility is very, very less. But when you have to get your body out of something, at least little bit of physical activity is definitely needed. Along with that, also, sun exposure is also equally important. So we worked on those areas as well. So first and foremost, we did diet changes. That means introduced her to anti-inflammatory diet, which is avoiding gluten, avoiding sugars, avoiding dairy products, and avoiding even oils, certain oils which could be inflammatory. So like your seed oils, mustard, or your sesame or groundnut, all these oils were removed from her diet, even olive oil for that matter. Then we had to improve her digestion and absorption as well, because there was gut dysbiosis present. So digestive enzymes helped us in that. And along with the food changes, her diet was going to also improve. And she was low on magnesium, vitamin D, so we also introduced that, so that her autoimmunity can be addressed. We also, her methylation was really low, because she had insufficiencies of almost all the vitamin B complexes. So for improving that methylation, we also gave her B complexes. To improve her antioxidants, and also to aid in the detoxification, like lipoic acid, N-acetylcysteine, vitamin C, all these things were introduced. To improve her mitochondrial health, CoQ10 was given to her. Probiotics to improve her gut microbiota. Then fish oil to improve the healthy fats, and curcumin, which is nothing but anti-inflammatory, were introduced. Along with that, as I told you, physical activity is very, very important. So we advised her to at least have go for a brisk walk, at least do sunbathing, for start with at least maybe 5 minutes and increase rapidly with maybe 10 minutes to 15 to half an hour. We also gave suggested a few techniques to manage her stress, because whenever her sleep was getting disturbed, or whenever her because obviously it is autoimmune condition and you're emotionally also low at times. So whenever her stress was high, her flare-ups would happen and everything would get triggered. So we suggested her, at least do some certain mindful practices which would keep her calm. And also light therapy, which is nothing but the red light therapy, or even if she was not able to tolerate sun enough, then she was doing this. Or even, because red light therapy is nothing but it is a therapeutic light therapy. So, any kind of aches and pain, because she had a lot of aches and pains. So that also helped her with it. So at the end of 3 months, we saw certain positive outcomes, which were that her gut issues like gastric, bloating, stomach issues were resolved. She was able to tolerate sun better. And as I mentioned, the frequency of flare-ups reduced, but only when she was, in tension or any kind of, lack of sleep, it would trigger. But otherwise, she was doing okay. Her sleep and quality of sleep also had improved because her mitochondria started functioning better. Her sweet cravings had reduced. Her body pains also had improved. And we could also see certain changes in her blood findings, like her lipoprotein had reduced, homocysteine, ATG, they also had they had come in range. Her lead has reduced. Um, Also, along with that, she was able to eat foods which she wanted to, at least, some amount of pulses she was able to take. She was also able to take a good amount of protein, because she was lacking in proteins a lot. So she was able to take that. And at the end of 3 months, this was her answer to us, that she was extremely happy with the treatment and she could go back to being normal, at least in some aspect. And I hope all of your questions, most of them, maybe you would be feeling that yes, somewhere I will be able to help others, or maybe somewhere you would be able to make a difference in certain aspects. With that, thank you. And Dr. Ruhi.
Yes, thank you. Thank you, Dr. Shefali. I'm sure people who are attending our webinar today have got answers to some of the questions that they were looking for. I was going through the questions that people had shared with us at the time of registrations, and most of them are covered. You've covered most of them in your presentation. So some of them which are not covered, I can take them now. And those who have questions, you can also raise your hand. We will allow you to unmute you and ask your question. So one of the very commonly asked question, Dr. Shefali, is, and given that we see that SLE is so common in women, right? So a woman in her reproductive age has this concern, will I be ever able to conceive, right, and deliver a healthy baby? And many times these women have been on biologics and certain other medications for many, many years. And then there's always this fear, will I be able to, be pregnant and deliver a healthy baby? So what do you say there?
So definitely, yes, pregnancy can be carried out, but as I told you, right, we know that there is a relation. Whatever mother has, it always goes to child. So we have to work that the symptoms of mother, and if she's taking medicines, whatever medications, that has to get reduced. Bit like I explained in the case also. So overall, after 3 years, 3 months, even her medicines were also reduced. So when all these positive things are there, then definitely yes, a healthy pregnancy can be carried out. But you should work since the beginning, that start preparing your body and then go towards pregnancy. It shouldn't be that you are pregnant and then
Yes.
going and solving your issues.
Yeah, because
Yeah.
it's very important that anyone prepares their body for a healthy pregnancy, because you will be nurturing a new life. So it's very
Yes.
important that you give your body, doesn't matter you have an autoimmune condition or whatever chronic condition, at least 6 to 9 months is the time you need to give your body, so that you can get rid of the toxins, you can address the infections, you can address the deficiencies, bring down the inflammation. Because if these are unaddressed, it will affect the child. The
Yes.
toxins, the infections will get passed on to the child, and
Yes.
the deficiencies will also be carried on to the child. The other day, a lady had reached out to us, and she had an autoimmune condition. And well, she herself being a doctor, right? So and again, a conventional doctor, so she was planning that, okay, let me get pregnant now. The pregnancy will kind of, bring down uh, the autoimmunity, right? So the pregnancy will be kind of safe. So that was the plan, and I was like, you cannot do this. Once you deliver the baby, you will have, crazy flare up,
Yeah.
right? And that's crazy. You cannot just go ahead and, you know, uh, have pregnancy as a safe, as a safety measure for the next 9 months. That's
Yes.
not something that anybody who has autoimmunity should do. Please prepare your body for a healthy pregnancy. So, all right. Another very commonly asked question is, someone who has lupus, should they go out in the sun or not?
Yeah, as I mentioned, I mean, definitely you will have initially, that issues with the sun, that your skin is feeling that tingly and everything. But as your antibodies start reducing, you will be able to tolerate sun. That's why start with lesser amount. Just go for 5 minutes, 10, because our body, runs on sun. I mean, it is circadian rhythm, so you cannot forget it. And people who have been, I'm sorry to say, but people who have been saying just apply some sunscreen and just go out, that's not it. You're, after all, you're applying a chemical on your body and then going out. You're exposing yourself to more toxins, right? So you should definitely go out in sun, and eventually you will. I'm not saying first day just go and stand for half an hour. No,
Right.
start bit by bit.
Yeah, and to add to what you've said, so start with 5 minutes, start with the morning sun, um, and then slowly you build a callus for the sun exposure. Uh, and as you see your body tolerating it, then you can also go out in the afternoon sun, where
Yeah.
you have the UV rays as well. And again, UV rays are not harmful for you. Uh, I also strongly recommend that and any individual should also take the evening sun, the setting sun. Again, the red light wavelength is highest in the setting sun. Plus, a setting sun has that ambience which brings a certain calmness in your body. You feel you feel a gratitude for everything around you, and that's very, very important in your healing journey. And again, to support this tolerance to sunlight, a very handy tool is a red light therapy. So in India, very commonly available is a red light lamp. And now you can also get a red light panel, which has red light and far infrared light LEDs. And it's an amazing tool to bring down the inflammation, to bring down autoimmunity, and help you build the callus for the sun exposure.
Yeah.
We've seen this working very well with our clients who had sun sensitivity, and eventually they were able to tolerate sun. All right, let me see if there's any other question that we need to take. All right, so there's a question: lupus patients cannot take vaccines. What's the alternative? So, all right. Now, see, I think this is something that the individual has to decide. You know, your immune system is dysregulated, the inflammation is high. Uh, Taking a vaccine and further creating havoc in the system, is that what you want? Right? And what vaccines are we talking about here? So, I will leave I'll leave this question for you to think over, to whoever has asked this question, kind of think over it. There is already high inflammation, and do you want to add fuel to the fire? All right. I think we've covered most of the questions in the presentation, so we can unmute. Shruti, you can unmute yourself and ask.
Hello.
Yes, yes.
1 second, doctor. I can't see you. Yes. Yeah. Hi. Actually, I wanted to ask you, so is it possible that somebody who has lupus, their ANA test can come out normal?
Okay. All right. So now, see, ANA is a general marker, okay,
Okay.
for autoimmunity. Now, definitely, ANA is tested in various ways. It is tested in a quantitative way where you can see how high the values are, right? And it is
Right.
also tested in a qualitative way where you see whether it's positive or it's negative.
Okay.
Okay. So, definitely, when you start working on autoimmunity, the ANA value will definitely drop down.
Okay.
Okay. Now, whether the qualitative marker, whether it will become completely negative, because again, that is dependent on, how that is being tested, right? What is that is being considered as negative? Okay. So I would rather say that, you look at the trend of your ANA markers coming down, right?
Okay.
That's the indication that whatever you are doing, that is working well for you, and you can see the autoimmunity come down.
Okay. Actually, my father-in-law, since many years, he has
Mm.
these rashes on his face.
Yeah.
They become extreme when he is under stress.
Hmm.
And the skin sort of peels off, and there's burning on the skin, and it's all over his face, even on the forehead.
Hmm.
It almost always feels like like the skin has been peeled off and it's red. So I was just wondering that then also he had a heart condition.
Hmm.
He got an angioplasty done last year, and since then he has also been complaining of breathlessness. So I was just wondering, is it lupus, is it an underlying lupus that is causing all of these issues? What could it be? So how do we go about figuring it out if this could be lupus?
Okay. See, Shruti, more than important, the diagnosis as such that, okay, he has lupus or not, right?
Hmm.
More than that, what is important is what are his symptoms trying to tell, right?
Okay.
And then what are his markers trying to tell him, right? If let's say you get a diagnosis, he has lupus, right?
Hmm.
Is
Hmm.
that going to, again, that may help you in choosing the conventional mode of treatment, what drugs
Okay.
to give, right? But
Right.
if we are looking in functional medicine, that diagnosis is not going to help us do his treatment, because for
Right.
us, we will be using his biomarkers, his sign and symptoms to make a plan of action.
Got it.
Okay. So, putting it in a bucket of whether he has lupus or not, that's not going to help. What is more important here is he has an underlying heart condition. He
Hmm.
has certain skin condition. Okay.
Right.
He has breathlessness. Okay.
Right.
So now
Yeah.
let's look at the biomarkers. What are the inflammatory markers telling us? What are his organ function telling us? What is his
Hmm.
mitochondrial health like? What are the heavy metals? What are the infections like? Let's look at all of these, understand the imbalances, and start working on it.
All right. So what I understand from what you're saying is that he doesn't need a diagnosis per se, but if we are wanting to figure out how to help him,
Yeah.
then we should get the correct tests done. So the
Yes.
thing is that why it's very difficult to get the older generation to come to particular doctors
Hmm.
to seek help, because they are sort of trained to just seek out the conventional medical
Yeah.
doctors, and they have not been able to find anything wrong, and he's bothered because he's constantly breathless.
Yeah. Yeah.
So, and also losing weight. So
Hmm.
okay, so I guess I sort of have my answer. Thank
Yeah.
you.
Okay. Thank you.
Yeah.
All right. Dr. Dubey, you can please unmute yourself.
Yes. Uh, Hello, Dr. Agarwal. I am Dr. G.N. Dubey, MBBS, MD Medicine, Assistant Professor in Department of Medicine, Darbhanga Medical College.
Yes.
And having a lot of health challenges for last few years. And I was exploring these things. I'm taking very few medicine in last 4 years. I have taken 2 shots of antibiotic due to some emergencies. Understood that antibiotic ruins your gut microbiome. And right now, I am having health challenges of AS and ankylosing spondylitis. And as per my clinical expertise, what I have learned in the last 4 years about the functional medicine, right now I am having both SIBO and SIFO and IBS, high FODMAP, food intolerance, very restricted food I am taking, loss of weight. These are all going on, not able to digest any fat and any protein, very restrictive diet and continuously losing weight. Uh, so, few questions in conventional allopathic approach, what I have learned in MD medicine. In ankylosing patients, you have only exercise, this swimming and NSAID, steroid, and this sulfasalazine, and of course, biologics.
Hmm.
So these are the only treatment, and I know all these are going to ruin the patient health further. So in the meantime, I learned many things about the functional medicine, but I'm not able to help myself at this stage. But yes, I have joined your program.
Hmm.
And few questions. In allopathic medicine, they say Klebsiella infection is usually related with ankylosing patients, and they are not able to tolerate starchy food. If they take starchy food, they get inflamed. So, is it possible to with this, what you have talked about, this mitochondrial health and a lot of nutritional deficiencies, if these are fulfilled, patient will be able to consume starchy food or high FODMAP food,
Okay.
or Klebsiella can be taken care of?
Okay. Dr. Shefali, you want to start some of his answering some of his questions? I can then add on.
So, for the last thing what you said, yes, definitely the patient will be able to tolerate food. It will not be immediately that today you start taking medicine, tomorrow it will be fine. But then definitely you will be start to have all those food. And regarding your, what you mentioned that your antibiotic and all those things, so some way they also disrupt your gut. And this is
Yeah,
like,
that
as
I
you,
know.
yeah. And you mentioned that, you had SIBO and everything. So certainly those leaky gut thing is there. That's the reason you're not absorbing any kind of nourishment. You're losing weight. So whatever you've been trying to do, I think that is just increasing the infections and everything. It's not
Yeah,
minimizing it.
whenever I used to take any pulses and things get worsen, any fat thing, that the tummy get worsen,
Yes.
symptoms and sleepless night are there for last few couple of months, not able to sleep properly. So things are going, and I was looking for this kind of platform, and I'm very thankful for you people. You people are doing great job, and even I am thinking in terms of if I get better, and definitely I'm very hopeful. I will get better with time, but it is not just like touch and go thing. It will take time, and we'll have to have patience
Yes.
with this
Yeah.
approach that I know. It may take couple of months, 3, 4, 6, 7 months. I know it very well. In the meantime, if I get better, definitely I will go with this functional medicine courses, what I have known through this platform. And I want to treat my patient in this way. Even
Yes.
in my clinic, I fear of prescribing, especially antibiotics,
Yeah.
especially antibiotics.
Yes.
Two important things I have to ask here. One is food allergy, food hypersensitivity, and food intolerances.
Hmm.
Are they, how they are different, these all three categories?
So, okay. So before I answer, let me tell you, doctor, you can be assured in the next 6 months, you will definitely be a different person in terms of your health. Okay. I can assure you that you
Thank
will
you. God
definitely
bless
be
you all.
able to, kind of have a healthy digestive system. A lot of your body symptoms will improve. Okay. We have had one AS case where after 3 months, the person's 80% of the symptoms had settled down. Okay. And I'm sure you will be willing to implement the recommendations with complete determination. And if you do that, you will definitely get better. Okay. Coming to your
I am ready to get my health back at any level, and even I am started visualizing. I do
yes,
believe in meditation and visualization, that I am
that's a very
doing
powerful
podcast.
tool. Yes,
That I have started visualizing that I am doing podcast with Dr. Hyman MD, who is founder of this functional medicine.
wonderful.
And yes, and my sister reside in Bangalore. If I visit there, definitely I would love to meet you people. And definitely it is a new dimension in the Indian medical science. And I used to talk people in my family like this, that for acute cases, definitely but for chronic cases, definitely functional medicine will do much better for mankind.
Yes. Yeah. And so coming to your question, so food sensitivity is basically your immune system is reacting to certain foods that you're taking. Okay. For example, right now, what you're experiencing is food sensitivity, right? Where you're taking and your immune system is just going haywire and kind of, ending up attacking the tissues wherever those components are going. But food intolerance is because of lack of certain enzymes, okay, which do not allow that certain food to be digested. For example, lactose intolerance, right? Or someone is not able to digest gluten because of the lack of certain enzyme. So this is how these are two different things.
And food per se, some person take peanuts and he uh, right way come to the emergency with swelled lip and
Yes,
itching
that's
and all
allergy,
things,
food allergies.
food allergy.
Yes,
So
yes.
these are the different tests you go with IgE, IgA, and something like that, or
See, in general, the
recommendation.
total Ig can be high, in an individual who has a leaky gut or has a very hyperreactive immune system. Okay. Now, testing for certain food allergies, the test that's available in India is not very accurate. So we usually do not get a food allergy test unless somebody wants to done it, in a good lab outside India. So anyways, with anyone coming to us with symptoms like, having a lot of food allergies and symptoms of leaky gut, etc., we have to work on repairing their gut. Okay. And as we do that, the food allergies will come down.
And one more thing, the supplement one has to take for longer period of time, or with few months, after few months, patient food will be like medicine and he's
Yes.
able to tolerate
So
all the food.
supplements are for a certain period of time, not for lifelong. Until your body needs that additional support, we have to provide it. And yes, certain basic supplements are good to take, like, the omega, the vitamin D, the B complex, etc. But the more specific ones are only for a certain period of time.
And last question, as conventional medicine say, starch is not good for many autoimmune patients, especially ankylosing patient. They keep away themselves from starchy food.
Hmm.
So in functional medicine approach, patient will able to tolerate this starch food and they are having no problem, no inflammation.
See, starch is basically carbohydrates, right? And
Yes.
food which are high in carbohydrates are we restrict that because they feed infections. Okay.
So in this way, you restrict grain. You don't ask people to go with the grains. So
No,
grains are highly
not
mistrusted.
no. See, again, it's the choice of grains, right? If someone is just eating white rice, it will definitely affect their kind of worsen their health. So we have to select the grains, complex grains. Again, we have to see if the person is able to digest them. Okay, so based on the severity of the symptoms that anyone comes to us, we decide on the on the diet that we need to start them on, and then switch them on to a certain diet. So it all depends on the kind of case and their signs and symptoms, etc.
As I knew, cruciferous vegetables are highly anti-inflammatory, but they are high FODMAP food. So, with the due course of time, those patients who are intolerant to high FODMAP food, as I see in my clinic, most of the patient comes with, I do usually breath test, and the SIBO positive patient,
Yes,
I usually ask them to avoid high FODMAP food. So, patient in this functional medicine approach, those patients, as in my case, I'm not able to tolerate high
yeah,
FODMAP food. So, which time I would able
you
to
will
tolerate
be
high
able to.
FODMAP.
Yes,
Ah,
you will be able
that,
to
that
talk.
that will be great news for me, since I knew these are the sulforaphane and the highly
Yes.
anti-inflammatory foods that will take care of all inflammation that is going on in your body.
Right. Yes. See, we
So,
have to provide your digestive system the support it needs, right? We have to clear up the system, and once we do that, the body will be able to tolerate things which are good for it.
thank you, Dr. Ruhi.
Thank
Nice
you.
talking you people, and good. And I see myself part of your community and doing such presentation and enlightening people with
Definitely, we look
few.
forward to that, doctor.
Yes, God has given me. I'm gold medalist, university topper. But in some way, what I learned, this is not the right kind of practice that I am doing these days. With my health challenges, what I have learned, this is further ruined my health. This biologics, a lot of side effects, infection, and the fear. Right now, even I live in fear. अगले पल क्या होना है?
Yeah. So
अगले
don't
पल.
worry. I'm sure, as I told you, give your body 6 months, and we will invite you again, during one of our presentations to share what you have to say.
Definitely, I will the part of the IFM. I'm going to pursue this 4 month program and IFM degree, and I will be part of this community, and definitely I will enlighten people with this approach. And
Sure.
my vision for last couple of months, I'm visualizing I'm helping people medicine free life only with few supplements that your body need to walk through.
Sure.
Come
Wonderful.
back to the platform.
Yeah. Thank you.
Thank you. Nice talking. God bless you all.
Thank
And
you.
all team. You people are doing a great job.
Thank you. All right. Anuj, if you're there, you can unmute yourself and ask.
Yeah, hi, good evening, Dr. Ruhi, and good evening, Dr. Shefali.
Yeah.
So first question is, regarding vasculitis. So have you had any experience curing vasculitis using the functional medicine till now?
Yes, Anuj, yes. Yeah. So vasculitis is basically inflammation of the vessels, right?
Right.
So let's understand it this way. Inflammation can affect any part of the body, right? Whether it's vessels, or when we're talking about RA, it's in the joints. When we're talking about psoriasis, it's in the skin. Lupus it affects various organs. So it gets its name from the part of the body it's affecting.
All right. And now continuing question is on the lupus diet, which we have just shared.
Yeah.
So did we restrict them on the macros like carbs, right? Can we say we put them on a low carb, high fat diet, or was there a particular ratio which we maintained for those macros which we gave them?
Shefali, you want to answer that?
Low carb, of course, it is mostly complex carb, which we give them. And fats, of course, not low fat, but, fats which are good for the body.
So
Those
like
things.
the coconut oil and
Like coconut oil or Bellona ghee,
cold
those are the
pressed
two
rice.
main things which will be
Okay.
good. Yeah. But carbs, mostly complex carbs, not simple carbs.
So were we keeping them on a certain ratio, like 100 grams in a day or 150 grams in a day, something like that? Yeah.
No, so your plate should be, if your 70% of the plate at least should be with vegetables and, all these things. And carbs maybe should be just around 20% is the best.
All right.
That would be better.
Okay, thanks. And on the supplements, did you give them a booster dose, say, for vitamin D and vitamin B12 before bringing them back to the daily dosage, right? Was it required in these cases, or they can simply start with daily dosage, right? So, for example, if we look at vitamin D3,
Hmm.
right, generally we go for 60K IU and then we bring for at least 3-4 days or maybe a week, and then we bring them back to 600 IU on a daily basis, right?
Yeah, so again, that depends on what levels they are coming, coming with. If let's say if someone has a level of, 25, then that's low. So then you can start with a high dose of like 60K for,
Right.
4 to 5 days, and then bring them to a daily dose. And again, here we are not talking about a daily dose of 600 IU, but at least 5,000.
Okay.
Yeah.
Makes sense, actually, yeah. And similarly for vitamin B12, so IV must have been given, right, in the start then.
So we usually don't use IV. We usually and again we do not want to just overload. And again, only B12 will not help. It has to be supplemented with other B vitamins as well. So
Okay.
we go with a balanced vitamin B complex, which has all the B vitamins in effective dosing.
All right. Thanks. I think that those answer my questions. Thank you for your time, doctor. Yeah,
Thank you.
thanks.
All right. Preeti, are you there?
Yeah, hi. Hi,
Yeah.
Doc. Hi, Doc. So, we're talking about lupus. This is my husband is a known case of lupus. So right now, actually, I'm in a dilemma whether he actually has lupus or it was misdiagnosed. But anyways, coming to the point is lupus being a systemic disorder, it tends to affect any part of the body. So when we are dealing with functional medicine, we are also obviously taking conventional medicine. Does functional medicine say that you can be weaned off conventional medicine and you will not see a lupus attack later in life, or it will not affect any other organ once you have done your functional medicine? Because this is something, some of course are lifestyle changes which you need to sustain for the rest of your life, but there are some things that you might do for a period of 6 months and then go back to a normal routine. So how does it work then?
Shefali, you want to answer that?
So, definitely yes. Your the medicines which he has been taking now, it'll be reduced eventually. And because see, the medicines which have been given are mostly just to reduce the symptoms which he has, right? So
More, I
when
think, is low and you are given immunosuppressant
yes, yes, yes.
in a autoimmune
So
disorder.
eventually when you start with this kind of functional medicine approach, then eventually your medicines will be going side by side. But when your blood markers and everything starts improving, then eventually they will go low. Okay,
Okay.
your current medications will be reduced. And regarding your for how long this has to be done, see, whatever changes what we do will definitely bring the inflammation down. So if your inflammation is maintained with that, so I think those things should be practiced for life, at least the factors like food changes and everything, okay,
Correct.
so that that trigger cannot happen.
Okay.
Yeah.
Some more questions to this. The thing is, gut health, obviously, gut microbiome keeps changing every 3 to 6 months. So then suppose I'm put on a probiotic. For example, he's put on a probiotic during the treatment. Do we go back to the probiotic based on gut health every 3 6 months, evaluating gut health? See, I'll be very clear. My husband, all his blood parameters are normal, including antibodies, anti-phospholipid, everything is normal. B12 is normal, vitamin D is normal, iron levels are normal, calcium, magnesiums, electrolytes, you name it, and everything is normal. Unfortunately, recently he had PT, that's pulmonary embolism, plus was diagnosed with a lesion in the brain, and he had to undergo a surgery. And every doctor is associating it to lupus. Though medical science says a lesion in the brain is very uncommon with lupus, but because they cannot point a finger probably on anything else, we just don't know what caused the lesion in the brain. We aren't even getting a clear biopsy report on the lesion. The best lab in the country has given two possibilities, which is Nimhans. They have also not given a clear-cut diagnosis on the biopsy report. So right now we are on ground zero. He has been in remission for the longest period of time. In spite of that, he has been gluten-free, dairy-free. I'm a nutritionist myself, so gluten-free, dairy-free, we are trying to do as much possible. In spite of that, after 14, 15 years, he had pulmonary embolism plus a lesion in the brain.
So,
So how do I know that
yeah.
I'm in remission? Or the lupus is not going to spread to any other part of because it's systemic, so it can just
yeah,
be
okay.
anywhere in the body.
Yes. So, Preeti, 2, 3 things here. One is when you say reports are normal, if you're referring to the lab ranges, right? Most of these markers will appear normal. Okay, because lab ranges के हिसाब से lab range are very broad,
Correct.
right? So if you're looking at that ranges, yes, the reports may appear normal where actually they are not normal. Okay. So in functional medicine, we look at optimal ranges, which are narrow. Okay. So same marker जो lab range में normal है, in functional medicine it's abnormal. That's the first thing. The second thing is, are we testing all the right biomarkers, right? So what you have said, in addition to that, a lot more markers can help us with certain information that we are looking for.
Yeah, I think she's
paused.
yes,
Okay.
Am I back now?
Yes.
Okay. So one thing is the lab ranges, right? They are very broad, so we need to look at the functional ranges. And the second is look at the right markers also.
Okay.
Right now, the lesion in the brain did not come out of nowhere. Right?
No idea.
And it's definitely, and I'm sure if we look for the right markers, we will be able to find the answers.
Yes.
Okay. And again, as Shruti had asked in the beginning, that her father-in-law does not have a diagnosis of lupus, right? So again, in your husband's case also, right, is it really important for us to figure out whether he has lupus or not? Or what is more important is, what are the imbalances in his body, which is kind of, leading to these kind of conditions in him?
Agree. That's why I said initially also that I'm not even sure whether it was lupus.
Yeah.
But at that time he responded to treatment for lupus, and so because there doesn't seem to be a clear-cut test that will say pinpoint and say that this is lupus, unless of course there are a list of symptoms, and if you qualify in four to
Yes.
6 of those symptoms, then you are more likely a case of lupus than.
Yeah.
So I do understand all those facts, but yes, 15 years down the line now, the question is, was it lupus in the first place? You're absolutely right. So that's but yes, he did respond to treatment to
Right.
lupus.
See, now what is the treatment for conventionally, what's the treatment for lupus, right? Right. It will be immunosuppressants.
Yes, that's
right.
what. Yeah.
And if there is high inflammation in the body, any individual will respond well to that.
Okay. Got it.
Okay.
Yeah. Thanks. Thank you.
All right. Yeah. Thank you. Okay, we'll take one last question. Balaji, you're there?
Yes, doctor.
Yes.
Thank you. Yeah, so actually, I was having some suspend during the last year, and eventually figured out that it was due to a B12 deficiency. And after that, I have gone through a complete health checkup, and it figured out that I was having very low platelets count. Just a minute. Yeah, I was having very low platelets count. So when I have gone through a couple of blood tests related to autoimmunes like lupus anticoagulant, anti-nuclear antibody, everything turned out to be negative, except one test, which is a parietal cell antibody, which turned out to be positive. So I just came across functional medicine and just wanted to see whether is this could be related to something related to autoimmune and can this be reversed?
So Balaji, it is autoimmunity, right? So you could figure out that there is a certain antibody against the platelet that's positive. Okay, so it's definitely an autoimmune condition and doesn't matter.
Disconnected.
Okay. Yeah, doctor, we lost you for the past couple of seconds.
I'm so sorry about the internet.
Yeah, no issues.
Okay, so definitely it's an autoimmune condition, Balaji, as your test also showed that you have an antibody against the platelet, right? So it's an autoimmune condition and doesn't matter what kind of autoimmune condition is. The baseline is to understand what is contributing to autoimmunity. Right now, it's affecting your platelets, okay? But then if we do not address autoimmunity, it will start involving other organs. Okay, it can start involving other cells. So what we have to work on is addressing why autoimmunity is building up in your body. And if we do that, we can halt the autoimmune process, we can halt the damage, and the body can recover.
All right. Okay. Yeah. So when I got in touch with the Dr. Ashwani Gaur, he mentioned that I have to make the dietary changes and improve my gut health, which can eventually lead to improvement in my platelets.
Yes.
So I started making the dietary changes, and I'm also a very active person. Like I usually don't take sugar, oils, and all. I go to gym regularly, and also every 4 days a week I do cardio. So I do all of those things, and I'm a software engineer by profession. But I used to have a very late night sleeps. That's one of the main reason if I have to classify myself as some unhealthy behavior, that is the only unhealthy behavior that I would put myself.
And that's one
That
of
is
the
one of the
major
major factors.
contributor, right?
Yeah.
Because we are not in sync with circadian rhythm then. And if we are going against nature, our body cannot, kind of be a healthy body.
All right. Okay. So that means I have to make changes to the sleep as well, and then.
Absolutely.
Okay. All right, doctor. Thank you. And will there be any medicine suggested for this, or will?
No, so we usually don't use any drugs. What we use are supplements.
Mhm. Right. And along with it, if you're taking some conventional medicine supplements, like let's say vitamin supplements for probably like better skin health, hair health, and stuffs like that, should that be avoided?
See, again, we don't want to overdo, right? So if when we take the history, you will have to provide us details of whatever you are currently taking, so that we can see, we can tell you which ones you can continue, while which one you can pause, because anyways, we will cover it in our treatment plan.
Got it, doctor. Thank you so much.
Okay. Okay. All right. So great. So thank you everyone for being a part of today's workshop, and thank you, Dr. Shefali, for that insightful session.
Thank you, Dr. Ruhi.
Yes. So all of you, we hope you find it insightful, and we will be back with another exciting session next time. So you can stay connected and be a part of our WhatsApp community. Thank you, all of you.